going to be recording this presentation. All right, Chris, please take it away. And come off mute.
You're on mute, Chris.
And first, I'm going to take myself off mute. And then I am going to once again put up my, I hope.
They're up. We can see your slides. It looks good.
You can? Okay, so why can't I? That's interesting. You can see the slides?
Yes.
Thank you. I will try. I wonder what's going on.
If you have a double monitor, it might be on your other monitor there.
I don't think so. Let me try. This is too bad. Now, do you see it?
You
Yes.
sure do. We see your mouse.
Can you see it now?
Yes.
Yes. Yep.
Do you see it?
I can see it and you can hear me, I hope.
Yes. Everything's good.
That makes it so exciting. Okay, thank you very much. It's good to be here. I really appreciate the invitation. A special shout out to Elder Jackson and Dr. Ellinger, who I noticed were on the screen tonight. So some people that I've known for a long time who are great advocates of public health and health equity in Minnesota. Good to see you guys. So again, and now I can't advance my.
How about, can you push enter? Push enter.
Not working.
Not working.
Nope.
Okay, how about you stop sharing?
Oh, maybe, no, wait. I can just do it with my mouse, I think.
Yeah.
Excellent. Now I have to try one more thing. Thank you. Sorry about this, trying to do it. And then I'm looking for how to get rid of my screen here. So my screen is in the way. That's too bad. Nobody knows how to do that, huh?
I can. Do you want me to share?
Okay, there we go. I think I got it. Okay, thanks a lot. Here we are. Oh, and so I'm bringing greetings, not only from myself, but also from the community of activists and community people who kind of have brought me into this and are really the backbone of the efforts to end slavery and to improve prison health. This all started in 1857 when the Minnesota Constitution adopted an amendment similar to the federal 13th Amendment that says slavery is abolished and involuntary servitude, otherwise or unless it's punishment for a crime for which the party has been convicted. And therein lies the problem with slavery in Minnesota today. And why does that matter? It's because of everything we know. People end up in prison because of forces in their lives, poverty, racism, poor support. And they have oftentimes mental and physical chemical problems when they come into prison, and they oftentimes don't get better in prison. And then after release, they enter back into the same neighborhoods, the same conditions, except now they're known as a felon. And that means they have restricted access to many services, including voting, et cetera. And this often leads to repeat crimes and recidivism. So the effort behind all of this from a public health and human point of view is we want our criminal justice system that makes people's lives better. So the poor health behind incarceration is, fairly straightforward. 70% of inmates, people in prison, have addiction problems, 55% with mental health, 40%, as you can see, chronic medical conditions, communicable infections, and injury problems. So there are health troubles. And this is applied across, all of Minnesota prisons. In the beginning of this year, there were a total of 8,000 or so people in prison. You can see the males far dominate. The offenses that people are incarcerated for, you can see 20% homicide, 20% criminal sexual conduct, then drugs, then weapons, assault property. The number of people who have life sentences are 695. And the racial distribution, as we all know, is what we see. Oh, by the way, if you have any questions or comments, please raise your hand or just speak up. I'm going to present a lot of facts behind this, but then I would love to hear everybody's thoughts, opinions, and what they might know from their own life and experience. But anyway, so what these numbers show is that although Minnesota is overwhelmingly white, the way disproportionate number of people incarcerated are Black and American Indian and Hispanic. And this is all before the whole prospect of sending to detention people who are immigrants. So what that's going to do to the carceral system, we don't know yet. So there's big problems in prison, as we've been talking about, and they often come from lack of resources and inadequate treatment. And quite honestly, as I learned while doing all of this, our systems really prioritize punishment over rehabilitation. So after people get out, as we know, they have a lot of restrictions that have been put on their life in federal jobs and training, housing, loans, education, food stamps, trouble reuniting with families that they've been separated from, and then reestablishing medical insurance and care, including mental health and chemical health. So it gets harder after somebody has been released from prison. So today, what I'd like to do as our primary objective is build support for the new anti-slavery and pro-worker bill. Both parts of that are very important, anti-slavery and pro-worker. So that's going to be reintroduced in 2026. It proposes a constitutional amendment to make slavery and indentured servitude illegal. And maybe most importantly, it proposes to reclassify prisoners as incarcerated workers. We have bill authors here, so Senator Verbatim and Representative Fraser, and we're in the process of working out what the language and strategy will be for the next legislative session. I also hope after we present all of this and have a good discussion, we can understand that the importance of making that change to our Constitution and making the reclassification of people workers, and to understand why the concept of public health, which brings us together tonight in our careers, needs to include all the people in Minnesota, including those who are incarcerated, and includes their families who are left behind in the community, and includes what do we do after people are released from prison. So it's a huge concern for our public, and I'm hoping that we can recommit to that tonight and start to think of better ways to serve the incarcerated people both during and after incarceration. So the big picture, the big idea of what's the best thing to do is to think about what has happened to produce mass incarceration and what would it take to abolish those causes, that activity in prison. In other words, what does abolition look like in the contemporary world? So that's what we hope to have happen. This is a slide speaking to my journey of awakening to these issues and to these problems. So again, I was born and raised in St. Cloud, Minnesota, in a white, middle-class family. So my view of all of this comes out of very much a white perspective. And then I really learned a lot through the civil rights movement when the murder of Philando Castile and George Floyd and Daunte Wright happened, the uprising, Black Lives Matter, And there's been a national movement to remove the exceptional clause from the 13th Amendment. And then in the community health work that I've done, when I've seen families who are still in the community and their spouses, fathers, mothers are in prison and are that produces a big burden on the family. And then what do they do after release? One of my fellow physicians also gave me some very good advice. And she said, you know, achieving health equity is part of the unfinished work of abolishing slavery. I am an abolitionist. And I have to say, when she originally said that to me, it kind of took me aback. I'm going, didn't that happen a long time ago? What is this all about? And let me tell you, I've learned what it's all about. So nationally, 8 states have already ended slavery in their constitution, but have not solved the issue of, so now how do we treat people in prison as workers and not as slaves? So yeah, we took out the word slavery, but there are still many aspects of slavery in the prisons. For example, the idea of indentured servitude, and this comes from a report that the ACLU did along with the University of Chicago in 2022, and they describe so well that out of all the people that are incarcerated, 2 out of 3 of those are people who are working and doing regular jobs in the prison, sometimes in the community, firefighting, repairing roads, all of the jobs that we call work and labor, and they're doing all of that, and they're not getting reimbursed really. So 13 cents an hour is the national rate for work inside of a prison. In Minnesota, it's 25 cents an hour. For outside contracts, of which there are a lot, with industry, university, firefighting, etc. In the U.S., they get paid 30 cents, and in Minnesota, it's 50 cents an hour. So once they get those very low wages, prisons deduct as much as 80% of that from incarcerated people's paychecks to pay for things going on in the prison, in room and board, etc. So in Minnesota, as you can see, 77% or $3.8 million were deducted in 2021 for the cost of confinement. And those deductions have gone into the general budget of the Department of Corrections to expand infrastructure and build new prisons. So when you look at that, the amount of money, 13 cents an hour, 25 cents an hour, is not much more than slavery. So not only does the word slavery continue in our Constitution, but paying people slave wages continues and actually steals millions of dollars from people who would benefit from it, like their children, like their families, and like paying restitution from their crimes. So the new bill that is cooking out there, it would end slavery, it would end forced labor, and it would reclassify prisoners as employees. And this, we hope and plan, to lead to getting the basic benefits of employment like minimum wage, health and safety standards. And it's designed, the bill is, to see that 50% of their work and savings would go into savings for when they are released, 25% would go to victims and child support, and then 25% would go for families and living expenses, and 5% for the Department of Corrections. So the bill would create a task force that would put together and make all of this happen and find jobs and find employers out there. Like I said, there are already industry and hospitals and corporations that have work that could be done by people in prison. It's now a matter of respecting them as employees and paying them thusly. So All of this can happen by stopping garnishing the wages, finding new contracts, finding savings within the Department of Corrections, getting medical assistance allowed. I know medical assistance has been on the chopping block. It's terrible. When we figure stuff out for that, we need to figure out why aren't people in prison covered by our public healthcare system. And so ultimately, if we need to use taxes, that's possible, because having a better justice system that treats people well so that they're in a better place when they get released, that benefits all of us. So they've done some financial analysis, the authors of the bill and the people that are working with them, and find that there's millions of dollars that can be generated by this kind of work, because the money that is made in prison gets out into the community to the families in restitution and generates more economic activity in communities that, again, really need it. And then there's taxes to be made from that money as it goes into the community. So it's a way to bring benefits to everybody, and it's possible. So what can we do as public health workers and supporters? So we can support the new law to ban slavery and indentured servants. We can get them reclassified as workers, bring the money back to the community, provide workplace protections for health and safety. And if this bill goes through, or when it goes through, or how it goes through, it will be a part of the solution, and there is more support, bigger reforms and transformation that is needed in the carceral system of today, and hopefully heading towards abolition of the way it currently works. So I've just included here, if you go to the website of the IWOC, you'll find there's a petition that you can download there. There's the URL. There's a fact sheet. And again, you can write to us or ask us. We can send that out, or you can download it here. There's a letter of support we've generated that makes the basic case for what we're talking about here, that I think most people would understand and agree with. And so we hope all that works. Will the bill pass in 2026? I don't know. Sometimes it takes several efforts, but this is something that we want to build as part of the movement. As the title of today's talk says, the struggle continues. So again, what I mentioned is this is part of a bigger effort to reform the carceral system. And just to remind all of us, the carceral system is kind of the whole ball of wax: policing, courts, prisons. It's more than just the prison buildings. It's the whole system that kind of can ensnare people early in their lives, often, or throughout their lives. And as we said, it often disproportionately affects marginalized groups and has, far-reaching economic and political consequences for their lives and for our community. This might be the most dramatic indication of this. This is the number of people in prison. And as you can see, starting about in 1980, this is what happened. And you've got to wonder why. So that was the people in prison. That's the green part here. But the control that is involved in people's lives extends into probation and parole. So even after people get out of prison, they're still caught in this carceral system, most of which doesn't change their lives or make things better. So this epidemic of incarceration, as that slide showed, is directly related to poor poverty, poor schools, poor neighborhoods, loss of job, the war on drugs. 70% of convictions in Chicago in 1999 were for drug offenses. Racial profiling, criminalization of marijuana, which now is legal and you can buy it on the corner. It's all called the war on crime. Militarization of our police forces and neighborhoods, which I'm sorry, is currently happening once again. Politicians have gained a lot of advantage by demonizing drugs in poor neighborhoods, and they've done that while they've denied the support to reduce the social determinants of poverty and health. In fact, there's a special name Republican Southern strategy where Richard Nixon started by substituting a criminal stereotype instead of asking his supporters to be against Black people. He said he's building a system against crime and drugs. So all of this has led to diminished rights for convicted and a recidivism rate or return to prison as high as 30 to 70%. So Michelle Alexander, who maybe you know, it's going to be part of your homework assignment. Sorry, you're going to have homework. But it's really, she has done an amazing job of defining the new Jim Crow about how the criminal justice system is really developed into a racialized social control system, mostly against Black Americans and other people of color. And it kind of took over for what Jim Crow laws did in the past. It's now done through the criminal system. So all of this can be addressed through the good work that we do in public health. So MPH's strategic plan is speaking especially to equitable public health practices and outcomes, meaning that within the organization and what we're going to work for within the public is looking at those issues that may have an disequitable, unequitable, racial, problem. And so that very much applies, I would say. We are in charge of, as public health experts, to paying attention to all of our public, all of our people, all of our communities. And as we well know, as the list goes on, it includes everybody. And I want to emphasize that I believe we need to be especially vigilant and committed and hardworking towards including our incarcerated public. They're still our public. They're still our people. They're still connected to our neighborhoods and communities, both while they are incarcerated and what health they get or what dishealth happens, and then also when they get released. How do we help them with themselves, their families, and community? And so that was the Minnesota MPHA commitment to diversity in public health. Here's the national APHA, who goes even a step further and saying that we need to be moving towards the abolition of the carceral system and instead building a system that is equitable and advances the public's health. So reduce the incarcerated population, divesting from the carceral system, investing in social determinants of health, and then committing to non-carceral measures for accountability, safety, and well-being. And I know that a expression of this at one time in Minneapolis took the form of defund the police. And that ended up not being an easy statement to make and support. However, understanding the broader commitment, the broader landscape of criminal injustice in the carceral system really asks us to think about what can we do other than policing, other than not that we're going to do away with policing, but how do we commit to non-carceral measures for safety and well-being? So that's part of what we're calling the contemporary abolition. And again, it's taking kind of root around the country, and it does emphasize restorative justice and community-based solutions, and divesting from systems like policing and prisons, which don't really solve the problem. Maybe they contain it, but they don't solve it or eliminate it. So what we want, after we do all of our work, is for people who happen to be incarcerated to get the best health that we can imagine while they are incarcerated. So, you know, kind of a full medical assessment, plans and goals, prevention services, mental health assessment, chemical assessment, withdrawal support, communication, and keeping the families in the loop. And then when release time comes, to provide transition that includes a good statement of what happened while they were incarcerated, what medications, and hopefully they can arrange, as when people get discharged from a hospital, they could arrange what their appointment at a local primary committee could be. None of this will happen, or all of this needs to happen with, as we know, in all of our medical or health institutions and public health, there has to be good measuring, there has to be good monitoring, and there has to be good enforcement by, most likely, an outside agency. And I personally would suggest MDH as the institution that's in charge of kind of taking care of, you know, all of our state's public health. So, in conclusion, please support the new bill. Please consider working towards the abolition of the carceral system as we know it, and to build a justice system based on restorative justice and community-based solution. The lessons that I have kind of gathered while I've started working in this prison house stuff is that the trouble and chaos that we're experiencing today really began before the current administration. And in fact, it's probably by not fixing or engaging in that trouble that we set it up for our current administration and current chaos. So as we know, our Constitution excluded African Americans, Native, and women. We had a civil war with 750,000 deaths, and then abandoned Reconstruction 12 years later. The 13th Amendment continued slavery in prison. There was sharecropping, Jim Crow, lynching, voting suppression, legislative redistricting, school segregation, and the courts didn't help, as with the Dred Scott case, which actually happened in Minnesota, where they denied a person who was brought as a slave to Minnesota, denied that he could be freed in Minnesota because he was Black, and Black people were not considered in the Constitution. And even the efforts of the courts today to restrict voting rights shows that the trouble that we're experiencing started a long time ago, and we need to look at that history as we get ready to repair it. I take heart from people along the way who have worked on this. This is Dred Scott, who brought that legal challenge. This is Harriet Tubman, an escaped slave who became a guide for bringing out other slaves, a scout in the Army, an activist, Sojourner Truth, an escaped slave, activist for women and Black rights. So Malcolm X, who said, we want justice, freedom, and equality by any means necessary. And he was labeled as a troublemaking revolutionary. Speaking of trouble, John Williams, John Lewis really encouraged all of us to get into some good trouble so that we can do things better. And of course, Martin Luther King, who is encouraging us to stick with it because the arc of moral universe bends towards justice. But maybe what I have come to like the most is Angela Davis, who I respect very much, who said, I am no longer trying to change the things no longer trying to address the things I cannot change, but I'm changing the things I cannot. So again, here is some references. Again, join our community. This is Marquise Bowie, who is a colleague and a friend in the prison movement. He also has written a book I just learned about this week that came out in May about his experiences of growing up on the streets of Minneapolis and then into the prison system and then into the recovery system. So again, there's homework. So the 13th Amendment, which tells the story of continued racism in the prisons so excellently, it's very much worth a re-look. If you have seen it before or not, I really, again, learned from it. And the YouTube of Michelle Alexander talking about the new Jim Crow, again, she's a very good spokesperson. It really tells the story well. And there are podcasts, one of them, Abolition Today, which again brings us up to date on where things are in the struggle for equity and prison health. So again, these are the connecting places that you can do that. Please do it. Enjoy it as you do. And I thank you for inviting me for this presentation. And I now invite and welcome any kind of discussion or comments.